All right, I'm Justin. I'm a licensed massage therapist here to Run a Quick Chiropractic. We have Sasha here today who's having some issues with thoracic outlet syndrome. That is basically when the muscles get so tight, usually up in the clavicle area, chest, sometimes the upper arm, it'll pinch off that nerve bundle that comes up right through the front of the shoulder here. And what she'll normally feel is numbness and tingling all the way down to the fingers. Sometimes you'll get a tight muscle feeling in the arm, almost like someone pumped your arm full of air and it's like really full feeling. It's typically caused by, a lot of times if you're in a motor vehicle accident, you're tensing up on the steering wheel, that forward shoulder motion. Anyone who works over their head, like swimmers, painters, carpenters, will be affected by this a lot. So what we want to do generally is we want to just lengthen those muscles and create a space for those nerves where they're getting pinched off. I start with the pec muscles. Those are the biggest muscles that are pinching right up against that nerve bundle. Start off with some lighter techniques just to warm up the muscle, get it pliable, get blood flowing. So what I usually do is I start right by the sternum. That's usually where the major connects, and then it runs all the way down here to the front of the arm, right where the nerve bundle comes out. So I'm just gonna do some light movements, get that muscle warmed up, which will make deeper work a little easier. As a massage therapist, what we usually want to do is work towards the injury. So the nerve bundle is right about here, and the pec muscle is going to be the major muscle we want to deal with. So I always want to work towards where that nerve bundle is to create some space. So now I'm going to go a little deeper with that. So when I go deeper, I usually use my fist or knuckles, and that way I can like really sink into that muscle and really push it and lengthen it the way I want it. Now the next set of muscles that will usually affect the nerves is the scalenes. So you got the neck muscles that will run and will connect to the clavicle, and that's also where you'll find a pinch point. So I definitely want to work the neck area, get those muscles lengthened out. All right, now that's warmed up, I'm gonna usually use my fingertips. Is usually the best way with the neck. You can just really dig in there and really push those muscles and get them nice and lengthened. Create space for that nerve bundle. So the neck has worked well, we got the pec majors worked well. What I do now is I usually just finish off this portion with a little stretch, which will really open up that area. So I'm kind of pinning down with the bottom half of the neck, of the scalenes and neck muscles here. And then just let me know when you feel a good stretch, all right? And then I push the head away and just really get those to stretch out. Right there. Mm-hmm. I usually hold it for at least 30 seconds. I find that it takes at least 30 seconds for the muscles to respond, and for the receptors in those muscles to tell them to release the way they should. So pec minor comes down here, and it has a big thick attachment. Pec minor's right underneath. So what I do is I'll go ahead and feel for the attachment. It runs pretty much right to the armpit here, and then it starts like right here, runs here. And I find if I get my thumbs in there and just get a good grip, I can grab pec minor and major, put a little bend to it. And just putting that bend in the ligaments and the outer part of the muscle, it helps release it. It's a little invasive, feels a little weird, but it works really well. So we're now loosened up and lengthened, and the pec minors are lengthened. All the connections on the neck are all lengthened, and the arm is flushed out. So now I just created a nice little space right where that nerve bundle comes out. So hopefully those tight muscles that are pushing down on that nerve bundle, hopefully now they've released enough to where the nerve can breathe and expand and start to heal and do what it's supposed to do without the pain.